Assalamu alaikum and a very warm welcome to the 34th session of LUMS Live, where we're going to be talking about Punjab's response to the COVID crisis. And this is one crisis that I think we can safely say has affected each one of us in one way or another. It hasn't caught any of us at a good time, but for Pakistan in particular, it was a pretty bad time. We were already in an IMF program. Fiscal space for government was already quite constrained. The economy was slowing down, and on top of that, you have a COVID crisis, which is not just quite severe, but it's also sustained over several months, and it's still ongoing. So, proportionately, it required a very substantial response from government. And today we're here to talk about Punjab's response, and particularly about the plan for the future, which has been articulated in a very aptly titled document called RISE, Responsive Investment for Social Protection and Economic Stimulus. And to discuss this, we have an excellent panel who I would like to welcome on board. We have with us Mr. Yaqoob Sheikh. He's the chairman of the Planning and Development Board, Government of Punjab. So welcome, Hamid Saab. We also have with us Ms. Sarah Cooper, who is the head of governance at DFID. And it was important to hear from DFID because DFID has supported Punjab government in developing this response as part of the subnational governance program. So welcome, Sarah. And from the subnational governance team, we also have Mr. Usman, who is the lead innovation and action research advisor at SNG, though I should say that his association with LUMS is much longer than that. He's been teaching at the Department of Economics for over 15 years. And also a warm welcome to Dr. Turab Hussain, who's Associate Professor at the Department of Economics at LUMS. So welcome to all of you. And I'm going to dive right in with you, Hamid Saab, to tell us more about RISE. When you were formulating this document, what were the kind of issues that you wanted to address in this document? And what is the strategy? Who does it target? What does it target? And how is it going to help?
Thank you, Nazish, and the panel. As you introduced, Punjab's response has been articulated in the form of a policy document, which is titled as RISE Punjab, which is Responsive Investment for Social Protection and Economic Stimulus. So this has developed in a very, very long and a very consultative manner in consultation with a range of stakeholders. So what really happened was that when COVID, the impact of COVID started affecting people, the initial response, like everybody else for Punjab, was to treat it as a health emergency. And subsequently, so the entire health machinery, along with the district administration, were mobilized, focusing essentially on health emergency. But with the lockdowns, it soon became very, very apparent that the economic impact would be only a few days down the lane. And nobody, for Punjab, I can say very confidently now that we had no idea how long or in what quantum would be waiting ahead. So our initial reaction to all of this was, as I said, to treat it as a health emergency and mobilize health services, health human resource to deal with it. We in Planning and Development Department, since we are not directly involved with the health side of the governance or service delivery, we started looking at economic impact. And as I said, our initial reaction was articulated in a very, I can now say, very perfunctory manner. We were looking at what has been done in terms of, disaster management in different occasions. So we were looking looking at COVID as just a small disaster. But when we got involved and we initiated discussions with chambers of commerce, with members of industry, with businesses, with economists, with academicians, we started realizing that the impact would be much greater. And so we started building on the former work, the work we had done in the shape of Punjab Growth Strategy, which was also a document prepared and launched a couple of years ago. And based on that, we looked at the pillars of the strategy and started expanding those pillars and looking at what we had missed in that. For example, two major areas which were not there were risk communication, for example, or disaster risk financing were two areas which were not clearly focused there. So we started developing our broad strategies around that. The initial package that we had developed was, we had titled it Economic Stimulus Package. And we presented it to Chief Minister, who constituted a steering committee under Finance Minister. And there were some, as I mentioned earlier, leaders of businesses, industry, academicians, economists, a range of stakeholders who I should appreciate. I've done that earlier as well, appreciate for their active participation. So this package, a set of reforms, a set of activities was then presented to the donor community through webinars, etc. And we've been supported throughout by DFID through the SNG program in developing this. So DFID has been very, very actively helping us in that. So when this was presented to, and this was, I claim credit for this, that this was the first formal organized response by any government in Pakistan. Federal government was developing a strategy, but we were able to articulate our set of activities much earlier. And when this was presented to donor community widely, and we had invited comments, and so with the help of all the comments, all the critique, this was then shaped into a formal strategy paper, which is called Rise Punjab. And again, Rise Punjab was circulated widely. We had invited a wide range of stakeholders, members of community to give their comments, advice, critique, so that we can improve. So the second version, which has now been printed and is also available on our Planning and Development Board's website, is actually a much refined version, and it now outlines government's strategy in crucial areas such as health, governance, education, economic response and recovery, disaster risk financing, social protection, excluded sectors, focused on women, for example, and vulnerable sections of populations, and last but not least, risk communication. So broadly, this is what this document is all about.
Okay, great. And we look forward to, I think, going into it in a bit more detail as we go along. But, for now, I know, Sarah, that DFID has played, and Hamid Sabit has acknowledged that, DFID played a very substantial role in supporting this in this document. And I'm wondering two things. I mean, one is a shorter question and a larger one, so I'll give you both at the same time. I mean, has DFID also engaged in similar work with other provinces as well? And also, I can imagine that DFID already had in place a program which didn't account for COVID, and it happened suddenly. And I'm curious. We want to hear from you, sort of how DFID was able to prioritize it. How have priorities for Pakistan changed in response to the COVID crisis, and how are you thinking and planning about it now?
Thank you very much, and thank you very much to the Punjab government as well for the opportunity to collaborate on this. It's a really important initiative. The first thing to say, to answer your first question, yes, we're also working in KP as well to provide support to the COVID response. Globally, DFID, the immediate coronavirus response amounts to around £744 million. And this is basically on top of work that we were already doing, pivoting much of our existing activity globally to provide health, humanitarian, and economic support where needed. I think the point has been made already that initially many people felt this was more of a health crisis, but as things have gone on, it's become increasingly obvious that this is actually obviously an economic crisis, and one which will have quite deep lasting impacts globally, not just here in Pakistan. Globally, the UK is the third largest donor to the World Health Organization. And we also make lots of investments in terms of research on rapid diagnostics and therapeutics that can treat coronavirus as well. We're doing a lot of work globally on innovative hand washing campaigns with Unilever. And we also work with countries within the G20 to basically commit to suspend debt relief payments to the poorest countries. So there's a lot going on globally as well that the DFID's doing. In Pakistan, it's a combination of short-term measures to manage and mitigate the adverse impacts, the most pressing and most urgent needs. So that's on, for example, humanitarian support on livelihoods, and also making sure that people can access health services. So there's a lot of work going on around that. And then on the more medium-term impacts, we're looking, obviously we're supporting this strategy and other strategies to try and build back better. So I think there are, although coronavirus is a massive shock, and it will be a huge shock in Pakistan and elsewhere, there may also be opportunities that come from this to enable us to build back better and build back greener. So it's really in that vein that DFID's working. A few examples, I guess, of the kind of work that we've been doing in Pakistan in terms of stopping the disease. We've done a lot of work, both in Punjab and KP, on maintaining essential health services and on things like water. So, for example, in Punjab, there's been a lot of work on TA with the Federal Ministry of Health and also in KP. We're also doing work on WASH, water sanitation and hygiene, promoting things like behavioural change is another big area of work for DFID. So at the moment, I think we spent around £7 million on behavioural change in Pakistan doing communications, basically around messaging around SOPs, which covers around 80 million people. So there's quite a lot of work going on there. And then on things like disease surveillance, we've provided support to Punjab's Forensic Science Agency. So it's a whole range, it's a package that we've had to change quite quickly and quite rapidly. As you know, normally DFID programs take years to come to fruition. So normally it would take us a year to kind of plan a new business case. But we had to really work quite hard with government and with partners to pivot quite rapidly, to do humanitarian work, to kind of really focus on economic development as well. So that's just a bit of a snapshot.
Oh, thank you. Actually, that's very useful. And yeah, the very quickly having to do things that normally takes years to plan. So credit to you, and also for both the immediate health response, which you've given examples for, and also focus on rebuilding, perhaps in a better way, using that opportunity. That sounds fantastic. I want to shift the conversation a little bit now to the situation that is on the ground, because at the end of the day, that is what RISE is planning to target, and the test for whether RISE is successful or not will also come from the extent to which it is able to change things or help people on the ground. And I'm going to come to you, Turab, because I know you've been working on SMEs and industrial development as well. So tell me, what is the kind of thing that we are actually seeing? I mean, what are there any particular types of firms or particular types of workers that are impacted more? And are there specific aspects of how the situation is handled that sort of creates or exacerbates sort of pockets of vulnerability in the population?
Okay, Nazish, thank you. So I think you mentioned it in your introduction. I think there's a need to contextualize Corona in Pakistan in terms of the economic environment which the country was facing just before and is currently also facing. We were in a recession. I mean, economic growth was around less than 3% across all sectors, services, manufacturing. I think agriculture was performing slightly better, but things were fairly dismal. We were in the middle of an IMF program, which led to demand compression. So that was the scenario when COVID hit. So COVID was like a double whammy, I mean, if you look at the market, so you have both a demand compression and also a negative supply shock. So really, I mean, across all the three sectors, if you want to look at the intensity of it, there's been some work done. So the services sector, which is the largest contributor in Pakistan and also in Punjab, was the worst hit. Then the manufacturing sector, and finally agriculture was more or less sort of insulated, although the initial lockdown, you had a breaking up of the supply chains, which had some negative impact. Now, if you look at within sectors, I mean, if you look at services, so you can think of retail, you can think of food and beverage, you can think of hospitality, initially transportation, education. So across a lot of services, you had businesses which really took the heat. In terms of what type of businesses were suffering the most, now Pakistan, majority of your businesses are small, medium enterprises. A large proportion of that are micro and small. Most of these are informal businesses, they're not registered. So they were the most vulnerable businesses which were run by women, businesses in small towns, in villages, and even in big cities, which were essentially small in size because they did not have the financial wherewithal to cope with the crisis. Is there any evidence on that? There have been some studies. So there was a survey done by Msme, and I think that's been reported in the RISE report, that they looked at 1,000 businesses, and out of that, 92% had major revenue losses, and almost half, 50%, laid off workers. So that's a statistic which is right there. I know you and Usman worked on a project, and you also did a qualitative survey. We're in the middle of something which we're doing. We're looking at digital space in Pakistan, e-commerce, and for that we're interviewing various firms, small, medium enterprises across the country. And again, similar patterns emerge. Firms which are run by sort of more educated, sort of highly educated entrepreneurs. There are in big cities which have a website, are into social media. Depends on the service they provide. They have very quickly, easily gone online. So there are cases of certain businesses which have actually done really well. They've taken this as an opportunity, this COVID and Corona times. Firms, again, in smaller cities, smaller towns, again, where the proprietor's education level is not that high, their familiarity with social media or digital e-commerce is not that. For them, getting onto online marketing products, selling them online has been a major challenge. And some of these firms have shut down, simply. So that is, in a nutshell, what's happening. Again, as I said, it's difficult to actually assess what the overall cost is. There are some overall macro estimates which are floating around, but clearly, I mean, there's been, at least in the initial phase, there was a high cost, it seemed, on businesses. Another thing which is important, and perhaps we can talk about it later, is that Pakistan did not have the strictest of lockdowns. There was a strict lockdown for around 2 weeks, initially in March and April, and things were loosened up a bit. So in some sense, the extent of the shock has been mitigated in this country, because there were certain sectors which were opened up, there was social safety nets were provided, so that mitigated the extent of the shock to some extent.
Okay, great. Yeah. So the impact has varied, and it as you said, that it's more the informal sector, the people who were less tech savvy, whose businesses were not able to go online very quickly and adjust, people who didn't have access to credit, that were more hit. And I just want to add to that also from my own research on compliances, it's for US AIDS program, which talks about also the kind of, we found that the kind of workers who were laid off first were the least skilled. were the more informal workers. And the mechanism to support them was also very limited. So the firms retained skilled employees that they knew would be harder to find. But so your most vulnerable workers are the ones that are, sort of laid off earliest. And the challenge also of addressing them or reaching out to them is quite substantial, because with state bank schemes and so on, they need the payroll to be going through a bank, and it doesn't for those people. So Usman, is there, Turab has talked about particular kinds of vulnerabilities. What specifically is there in the RISE plan for these vulnerable groups?
Yeah, thank you, Nazish. I'll just pick up from the last point that you made. Actually, in addition to the work that we did with Punjab, and then SMEDA did a survey, and also UNIDO has also done a survey as well, and the qualitative work that was done for the SMEA project. I think if you look at it in numbers, I think about 90% of the benefit of the state bank's main scheme, which was to provide 3% loan to retain workers, and the money could be used to pay wages. 95% of that has been used by large firms. There's only 5% response by medium firms, and small firms have been actually not been a part of that. They've been unable to. There have been two reasons when you discuss with them. One broadly is they do not meet all the compliance requirements, because it was required that they need to provide all the EOBI forms, all the social security payments. So where the workers were retained, firms actually, most of these smaller firms make payments in cash. So that means there wasn't a record of those payments. And secondly, the other issue was also identified was in terms of the information that was available and how the firms go about actually filling in those forms, and where even they had those documents, they did not have the capacity or the time, and were sometimes also discouraged by commercial banks that it's a long process, so why take that route. We actually, as part of our implementation element with the RISE strategy, we actually then, under the chairmanship of Chairman PND, also have established an Msme committee, which is basically looking at the financing issues of the micro small firms. Now, there are two things that the RISE strategy going forward actually talks about. One is that we've actually established a 9.5 billion rupee fund, and I'll come back to that later. That's a direct support. But we also realize that, as a province, as a subnational government, there's very limited fiscal space available to the province to actually, start a loans program which could cater the 70% population of SMEs that lie in Punjab. So instead, what we've actually realized was that, because of this information gap, maybe we need to use agencies such as Punjab Small Industries Corporation in a better manner, where they sort of start to work in developing capacity of these smaller firms so that they're able to better access the state banks. And also by using that engagement, provide more specific feedback to state bank and policymakers that if they want to design schemes in for such a disaster management, they should be more inclusive. So that's the work that we're actually doing. So in there, we're actually trying to work with Bank of Punjab and Punjab Small Industries Corporation to actually start training facilitative officers, because PISIC has field offices, so they have a lot of access to the small cottage and micro industry, and they can then start to work with them in terms of what schemes they would work. Coming back to the 9.5 billion scheme that we have, we again discussed that as in light of our RISE strategy, and one of the biggest sort of the reasons of the economic shock is also the loss of consumption. So the consumption shock that has actually come into the economy due to two reasons. One, people have lost jobs, so there's lack of demand generally, but also the uncertainty created in the market, and the production cycles are slower. The markets sometimes are open, sometimes they're closed. So there's the credit cycle in the market has also been broken. So most of our sales, especially in the SME sectors, are on credit, and there's a whole cycle where goods flow and then the cash flow. So when the government actually went into a lockdown, that cash credit cycle was disturbed. That means that cash went out of the system, and now it's finding it hard to actually come back into the system. So what we've done with this 9.5 billion is to actually have different segregates where one could support loans for just recouping the losses and sustaining. So there's a component on that, which is basically purely from an inclusion point. We're also looking at parking part of these funds for microfinancing, and they could be basically they could also be consumption-based loans. So working with entities like Yaqoob and other similar microfinance institutions. So actually we try to build that consumption consumption element. And the third part is more for, because, as the research we've done also together, there's a lot of new opportunities that have emerged. In fact, we always quote the survey numbers where we say that 90% of the firms actually saw a decrease in revenue, but there are 6-7% which have actually seen an increase in the revenue because they've diversified into opportunities. So we've kept a part of the fund to actually facilitate those new acquisitions. For example, there are a lot of small garment manufacturers which are now moved into making masks and PPE kits. So there is an excess capacity, but to export this excess capacity, what they need is compliance support. So there's funding that they could actually leverage to actually start to do that. So it's more targeted funding. One more point on the inclusive part that I want to make is, looking at the women businesses. So they have very specific, slightly different issues, although they, in my discussions with them, and I think in one of the meetings you were with me as well, I think that they're more enterprising generally, and they've actually tried their best to move on to the digital marketplace. But there are two issues that one faces there. One is the lack of trained staff. So the sales staff that you need in e-commerce is very different to what you would need in the normal retail business. The other is also the space issue, because when you're running a business in a physical presence, your warehousing and your storage capacities and your storage strategy is completely different. But when you move into an e-commerce business, your warehousing and how you manage it spatially is very different. So those are a couple of issues. So what we're doing there in terms of our implementation through the RISE framework is that TEFTA has already started, proactively started in partnership with private sector, free of cost trainings on both of these issues. So training students on how to market in digital commerce, and they've also sort of worked with the private sector. The other area is again with the Punjab Small Industries Corporation. So there's a cluster development program which is looking at cluster specific or sector specific issues and how we address that. Specifically for women businesses, there was already a scheme that was in place to set up an incubation center with Lahore Women Chamber. So the industries department is the implementing agency, and we're discussing to actually expand the scope of that to actually include a bit of more space where, and also include the component of this technology training and accessing the digital marketplace for women who are actually interested to market their products. One last thing I want to highlight before we move on to onto the second round of questions is that in doing all of this, one of the critical issues was also the lack of access of credible data. So we had the access through the National Social Security Registry, the NSER data, but basically which is the best data, but that's slightly outdated, and it was meant to be developed for a slightly different purpose. So when we actually were developing, especially on our RISE framework, the element of social protection, there were fairly strong limitations on the best data that we saw. So as a result, what we're doing now is that we've already developed a spatial vulnerability index, which basically identifies the pockets of vulnerability in case of a disaster. So whether a disaster is related to flood, whether it is like a health pandemic that we got in case of COVID or any other disaster, where does the vulnerabilities lie spatially so that one could really trigger an action based on that. The other thing that we're doing is we're actually trying to create now a provincial database as well for social protection. This includes steps such as reforming PESI in terms of moving towards worker self-registration models. At the moment, firms need to register their workers, but we're trying to now design a system where workers can actually self-register. So in case there is a disaster again, there is more credible data that is available. So I think there are a lot of steps that actually promote these excluded groups in terms of responsiveness towards such a disaster, even if it hits again.
Great, Usman. I was actually really glad to hear that they're on the credit side, that they're demand side measures as well, because typically the programs are there to provide credit, but they are not accessed because firms, more than, not being able to access, a lot of times there's a perception that that's unattainable and they don't even try. So I think that kind of hand-holding is really useful. And just a quick question and clarification on the spatial vulnerability index, is that at district level? The data that is...
Yes, that actually it's at a level lower than district. So within district also, it will identify the vulnerabilities. We've actually just almost close to, we've done a concept paper on and identified the indicators that we will be using. So the mixed data actually goes a bit level lower than the district as well. So we could really go to that level.
Okay, great. Great. So Hamid Sahab, this, one thing that, I've got a lot from my field research, and what firms say is that it's not the lockdown itself that's problematic. It's the suddenness of the lockdown. When you, like before the first Eid, the lockdown was lifted just a few days before Eid, but because they didn't know it was going to be lifted up, they were not able to stock, and they weren't able to take advantage of that window of opportunity, which is actually the time when they do their peak sales. And similarly, just before the second Eid, we went into lockdown again very suddenly. And this is not just specific to COVID. When we speak to businesses, uncertainty and quick, sudden changes in policy is something that they bring up as one of the top impediments that holds back sort of investment into the province as well. So, I mean, I can understand that this COVID situation does require, responses that are fairly, you don't have tons of time to plan them. If the disease rate is skyrocketing, you have to take a decision. But is there anything that we can learn from this going forward? I mean, and specifically for COVID, we're in a situation now where we have Punjab is pretty much open for business. Everything is open. We have Muharram around the corner. The disease hasn't really gone away. People are becoming complacent because disease rates are dropping. So in a sense, there's a perfect storm brewing. We hope it doesn't happen, but there's certainly a chance that we'll have a second spike, and we need to plan for that. So how is Punjab government thinking? What are the things that we've learned from the earlier lockdowns, or the way those lockdowns, so not the lockdown itself, but just the way that it's managed, the less sort of the suddenness of it. Is there anything that's part of your plans now?
Well, firstly, as they say, hindsight is always 2020. So we now much better informed. But like everybody else in the world, we were also learning on the go. There were competing demands and challenges that government was facing, and and Usman has covered those issues, raised those issues in his discussion. The challenge was that despite monies being made available, we were not able to reach vulnerable sections of our society. We were not able to reach informal workers, daily wagers. We did not know where were small businesses, micro businesses. Government wanted to help, but didn't know how to do that, how to reach them. So the pressure were really economic pressure. So that is why you see, shift in policy, and you've seen that the federal government and all the 4 provinces were experimenting and adopted a different approach. And I think what we have learned from this experience is, one, that the mechanism of working together in a coordinated fashion through this National Coordination Council is in a disaster situation is something which should continue, and what is an experience that we can take forward in other, God forbid, other disasters or other situations. We now have a similar council or similar body for locust control, for example. So one, yes, the governance and the preparation part of it, or data sharing part of is something which we are now better equipped or better prepared and learn from experience. The other important learning for us is that we have to be smarter as far as lockdowns are concerned. So that so instead of sudden lockdowns, it will have to be more focused, more gradual, more kind of targeted towards areas. So we've seen in this time, we saw testing being done more generally. This can be more targeted in future if such a situation arises. Similarly, provision of facilities. We had set up hospitals in every tehsil, in every district, in every major city, whereas the burden of disease shows that it was much more pronounced in Lahore, for example, compared to some of the rural towns or hinterland. So attention needs to be more targeted and focused in those areas. In this crisis, the entire administration did nothing else but fight COVID, and that probably helped too. I would not take discount anything from the effort. So I think these are the kind of things that we've learned. So reaching out to vulnerable population is, I think, the most important part that we've learned, that there are gaps in our databases that we need to cover. And we're trying to do that through the Spatial Vulnerability Index that we're trying to develop in collaboration, in conjunction with this. So it's not Punjab, separate database. It will be aligned with this, so that we have ultimately have a one large national registry, so to say. And you must have read from newspapers as well that federal government yesterday or day before, they have allocated funds which were not used last year. So this is not a matter of funds not being available. Funds were there, we were not able to reach out. Yeah.
Okay, great. Thank you. Thank you for that. And Sarah, sticking to the topic of learning again, I mean, because DFID operates in multiple countries and you've got experience of that. What are the things that, I mean, everyone's experience is different, so I wouldn't, the comparison is also, consequently different. But how does Punjab generally stack up, and what are the kind of things that we can learn from other countries and sort of to incorporate in our own context going forward?
Thank you. Yeah, I mean, I think for DFID, the response and how we deal with the crisis has varied enormously compared, basically depending on the trajectory of the disease. And as you say, I think in Pakistan, the size of the country, the size of the population, the economic impact of lockdown, which is really quite hard, and it's very hard to do lockdown here, and the scale of the challenge, the policy challenge is a lot bigger here than perhaps it is in some other countries, although obviously, arguably, the trajectory of the disease is kind of slowing down. I mean, I think within the DFID network, there's huge diversity, so we're learning lessons as we go, and we're also learning from our experience in the UK. I mean, I think there's really interesting success stories. If I look at places like Sri Lanka, where although it has a very small population compared to Pakistan, it has, comparatively fewer death rates when you compare. I think in Pakistan, obviously, it's a different thing. I mean, I think what Sri Lanka did well was investing in low-cost healthcare, and I think they've done that for years, and I think that's actually a really good lesson for many countries. I think there are really good lessons around communication as well, in terms of how we communicate with communities and how we make sure that the messages from communication campaigns feed down, and how these are locally developed. So there's really interesting lessons around that. I mean, I think where Punjab stands out, I mean, I think some of these points may have been made already, but I think the fact that Punjab pivoted quite quickly and focused on the medium to longer term and did that at speed, I think that was really, really important. I think that the fact that the level of coordination in Punjab has really stepped up, and I think they've actually worked to prepare a comprehensive, thoughtful, response to it. And I think that the big focus that colleagues have already talked about around inclusion is another important issue that in some countries hasn't been taken into account as much. So I think there are a lot of very positive lessons, I think, from Punjab. But as I say, because this is a global pandemic, and many of us haven't seen this before in our lifetimes, we're all learning. And I think what's really important is with the right strategy, it's also about making sure that we monitor the strategy and monitor how it's actually being implemented and the unanticipated consequences of that as well. And I think the lessons will we're learning things now, but we really are early on in this crisis. And as time goes on, if we have a second spike here, again, I think these are areas that we'll start to learn from and refine our approach going forward. But I would agree with colleagues that have already spoken, who have said that ultimately it's about working together. And I think for DFID, we really value the partnership both with S&G colleagues and also with the Punjab government on this.
I think so. One of the things I wanted to add, and I just asked, and I sort of missed, was that so a major lesson and something which the government and everybody needs to do in future is observe what what has so far worked for us. Let's continue to practice that. For example, social distancing. Which have suddenly, we stopped. When you look around, we see a lot of people getting together in malls and shopping areas and restaurants. I think we need to be very, very careful and continue to wear masks. And for government and for community leaders, I think the communication part is still very, very important. And I think we need to emphasize and re-emphasize the message that the disease hasn't gone away. We need to remain cautious and practice all the good practices that have worked for us.
Great. Yes. Sorry, Sarah, I missed the last part of what you said, but I do want to come back to, because you spoke about implementation as well. So I do want to come back to that later, because it's all very well to have plans and strategies in place. But I want to pick up on something that you said before that on Sri Lanka and about, having a low-cost healthcare system already in place that made them sort of more resilient to this kind of shock. So, Turab, I want to ask you this. How resilient really was Pakistan's economy when the COVID crisis hit? And what kind of recovery can we expect given how things are? I mean, we're very much still in it, but what are you seeing? What are your thoughts on recovery?
Look, I mean, it was not very resilient, because we were in an economic crisis, so to speak, before COVID hit. So, with the exception of maybe some sectors, otherwise, the economy wasn't doing that well. Now, and as I said, COVID was like a double whammy. So, and the first couple of weeks, I think at end of March and then April, when there was a strict lockdown and everything was shut, then really, I mean, the economic impact of Corona really hit Pakistan hard. But since then, there's been a gradual relaxation of the lockdown, and now, as we all know, it's been more or less lifted. So because there was a gradual relaxation, so I think it's not as if it's not gonna be a V-shaped recovery, so a dip down and then a quick move up to wherever the normal was. I think it's sort of a flat U-shaped in the case of the country. Because of the fact that things have been relaxed over time over the last 2 months. But having said that, I think we shouldn't throw caution to the wind. In June, we saw right after first Eid that there was a spike. We've had the second Eid, numbers are coming up for reasons which are not very clear at the moment, which perhaps would be after research is done on Pakistan, that the numbers haven't gone up that much. But then we have another religious occasion round the corner, which is Muharram. And we know for a fact that around the country, whether that be big cities, small towns, villages, SOPs, unfortunately, are not being followed. I have traveled around, so this is anecdotal evidence. You hardly see people wearing masks in small town, in villages, whether that be in Punjab or even in Khyber Pakhtunkhwa. Same is the case in your big cities. So I would be really cautious at this stage, and I would have liked that perhaps relaxation should have been there, but I think the lifting shouldn't have been this sudden as it has happened in this country.
Right. And so there is one interesting sort of aspect, and so far it's just anecdotal, but I want to see, especially Usman, because you're also doing sort of field research on it. What we're finding quite interestingly is that the US-China trade tiff is somehow impacting our exporters quite positively. So we've got, where we've got all of this doom and gloom and bad news, we've got a bit of good news in that direction as well. So exporters that I've been speaking to, and again, it's not a representative sample, so just want to hear thoughts of everybody on the panel as well. Some of them are actually doing very well. What do you think?
Yes, Nazish, I agree. I think a few sectors that I've also spoken to while we were doing this, they have seen markets, new market opportunities, especially I think because our cycle of COVID was slightly delayed than from China and other sort of countries similar to that. And in the initial period, actually, they did see, they'd already started to see this transition happening from, US diversifying away from some of the products that were being sent from China. And even now, I think that's why I said that, we always miss the silver lining, which is the 6% responding that they've actually seen their revenues in the last quarter, despite being closed for a significant time, actually increasing. Most of them are exporters. But again, I think the challenge remains, and that's, I think, where we were very careful in building our response on the Punjab side, from the policy support side and the regulatory side, to support those more innovative and more sort of forward-looking businesses in the province that can actually move on to that. Because wherever they're diversifying away, but they need to understand that China already has a significant advantage in terms of cost, so they need to meet some of the expectations of the buyers. I think I've spoken to some people in leather. There was a decline in leather generally, but now they see some uptake coming up. Similarly, I think I was just reading an article yesterday. Even trade with UK has increased in the last 2 months as well. And the numbers that was quoted by the finance ministry yesterday has a significant portion which suggests exports to the UK. So I think there are opportunities that are emerging, and still they will continue to, because I think this pandemic is not over yet, especially globally, and things and markets are changing. And I think that's where, in my discussion with both Hamid Saab and at the P&D level, what we're trying to now focus on and more is actually move towards a more stronger policy and creating an enabling environment where we are able to help these forward-looking entrepreneurs from the province to actually tap onto those opportunities.
Yeah, absolutely. I think that's another finding that comes out, that sometimes the conditions, the regulations that there are for importing raw material and exporting raw materials are such that it wastes a lot of time, and that window kind of goes. Turab, you wanted to add something?
Yeah, I just wanted to add what Usman said. I think as Europe opens up and hopefully North America, I think there's going to be a surge in demand, and this is the time when developing countries like ours can really cash on, if you have capacity to supply and capacity to export. So there were certain things which happened. I mean, interest rates were lower, tax relief given to businesses. I think that should continue with sort of looking at your regulations, putting down the regulatory guillotine just to reduce cost of business. So remember, I mean, it's not just Corona. I mean, Pakistan has certain chronic economic problems. So, going from -2% to 2.5 or 3% doesn't work for us. We need to really go towards 6 to 7%. So you need to have a longer term view of economic policy. Yes, have the COVID focus, but things should be more permanent in nature, because giving certain benefits to industry, to business, which are temporary, and just lifting them later would be very problematic.
Yes, absolutely, and I think that's what I liked about the about RISE, is that it's a sort of, it's not a quick fix sort of solution. So we do need quick fixes as well, but at the same time, the economy's fundamentals were needed to be sorted out even before the COVID crisis. And if we're going to truly grow, there's no way that we cannot fix them. But I want to come back to what Sarah raised earlier on implementation. So Hamid Saab, there's so many documents that are made and they look great and they read so well. But then at the end of the day, if you see it sort of 5 years later, 10 years later, the same problems are there. They've not been implemented. So, what are the challenges there? Is there anything that, you have in mind or you have in place to sort of really get this implemented?
We were very cognizant of this when we were converting the metrics into a document or into a policy. And we've, as you said, and rightly said, that there are several, growth strategy and vision documents that everybody develops, but they, in the end, remain on the bookshelf. So what we've tried to do, and only time will tell if we've been successful or not, is that focus on not in a very long term. So RISE is essentially a medium-term, immediate and medium-term document. It talks about things that we've needed to do right away in the budget, and a lot of that we've done already, and some of it is which will take us to next growth strategy. So it's an intermediate kind of document, a medium-term kind of a document. So for example, on the economic side, because some sectors were the hardest hit, or some sectors were, our priority sectors, service sector, for example, IT-led services, food delivery, or generally delivery services, courier services. So the government has announced tax breaks for them to the tune of about 18 billion in the last financial year. And in this budget, they are about to the tune of about 56 billion rupees, and the interest rate has been the tax rates have been substantially lowered for them, from 16% to 5% or even 1% in some cases. So that's what we've already done. So this is following the RISE document. Similarly, we had a large annual development program, which wasn't really focused on the kind of things we need to do to spur economic growth, to provide livelihood. So in RISE, you'll see there is a ADP framework at the end, which we use to tailor the old ADP existing development program into RISE compliant development or public investment program. So this year, the entire development program is very well aligned with the RISE document. The departments and all the agencies were given instructions which are at the end. We gave them a matrix with which they were able to make it compliant or aligned with the RISE document. So the focus is on spurring growth on both on the policy side, through, as I said, tax breaks, as well as taking measures for easing the regulatory environments. There is a focus on ease of doing business reforms. Then a lot of focus on, actually substantial focus on lives and livelihoods, providing economic opportunities for people, labor-intensive schemes. 1 year, small works programs. These are the kind of initiatives and projects that have been included in development program ADP 2020-21, which were talked about in RISE document. So, this was things which were immediate, and we've already implemented them. But some things are obviously more kind of medium and long term. We've talked about them in the document, and we've continued to work on them. And hopefully in following years and in the time to come, we'll continue to work on them. But as I said, honestly, only time will tell how much of this document is followed.
Great. Great. Yeah, time will tell, but also we can make it. We can try to make it happen. So, one sort of final question, and anyone, because we've got just a couple of minutes left, and I'm thinking about the way forward. I mean, this COVID situation is, hopefully it should resolve itself in the next couple of months. But there's something that Usman brought up earlier, which is that when we were hit with the COVID crisis, and the very immediate thing that we needed to do was to reach out to all those people that were affected by the lockdown. We needed to identify vulnerable people and reach out to them, and there we found that the BIS data set hadn't been updated for years and years, and it had just targeting people at both inclusion and exclusion errors. There may be another crisis of a different shape, maybe climate change related. We've got locust situation on the corner. Are there any other things that we can put in place now? I mean, you've got that spatial index that you spoke about, and then you're planning to integrate with BISP as well, which I think is very useful, because when you said spatial index, I was thinking if it's at the district level, that still leaves you with the challenge of identifying which household you need to reach and to what extent. Are there any things that we can put in place to mitigate and address future calamities of this sort?
Can I say something on this, Nazish?
Yeah.
So basically, I think just taking ahead of what Hamid Saab actually explained, the other thing that we've also done, and we're actually doing it, is the entire process of how the government responded. In this case, some things may work out, something may not, because it's again a response, and things could modify. But what we've actually seen is that what we've done is by taking this quicker route and sort of finding it is taking more of a problem-driven approach. And what we're now trying to do, luckily at the same time, the SNG program was also working with PND on developing a planning reform strategy, which does not only cover PND department, but it's the overall planning and economic strategy making for the province. And in middle, this COVID situation hit. So now we're actually having a whole section on planning for a disaster situation like COVID or any other. And what we're trying to capture in there is the learnings that we've had in the last 6 months in terms of how this response was developed, how we actually acted, what we learned from that, how could we have done some of the things in a better manner, and making it as a dynamic policy tool that is available to the government, in a more documented form. So in an unfortunate case where we are hit with such a disaster again, there is at least a reference check that these are some of the initial things that we need to do. This is how we sort of articulate teams. This is how we sort of go about. And some of the lessons that Hamid Saab, for example, mentioned that initially, because and this was a clearly an exceptional situation, so maybe the response at that time looked rational, that we had limited resources, but we went out in terms of health and providing these mobile hospitals across the districts of Punjab. I think a bit of careful thinking at that time could have also sort of indicated that if we had looked at trends in other countries which were ahead of us in the cycle, that this was predominantly an urban disease. We could have actually, using that evidence, predicted that the disease burden would be much higher in more denser areas such as Lahore, Rawalpindi, Gujarat. And now that we have the statistics, we can clearly see that in the 6 most populous districts, the numbers are in thousands, whereas for the remaining 30 districts, the numbers in just few hundreds. But the resource actually went out with setting up these mobile hospitals, which actually did disrupted health facilities in those districts, because we actually closed the OPDs of Tehsil headquarter hospitals to normal patients. So we actually denied that access to health just to respond to this emergency. So those are so we're actually at the same time, what we've done is we actually documented all of these things as well as learnings, and using these reflective sessions, and we engage with the PND team and the team that was involved quite regularly, so that we in that document also come up with this element of how should the planning department and government, from a planning perspective, respond to such disasters in a future case. So I think that has been an additional exercise which usually we miss out at the end while we're doing the celebrations, that we were able to actually respond well.
That's great. Sarah, would you like to add to that?
Yeah, just finally, I think one of the other areas where we need greater investment globally is in global public health systems. I think that's an area that's been really underinvested in, obviously not just here, but elsewhere as well. And I think with COVID, in some ways, it does provide a huge opportunity to rethink about how we do economic development, to think whether we could do things more greenly. I think with climate change as well, we have to think a bit more probably about how we plan for kind of dramatic climate events which we think are coming our way. And the urban centres, as colleagues have said, are probably huge areas which will be affected. So I think we just need to do a bit more forward thinking, forward planning. But I don't think that's just Pakistan. I think that's actually in like a global sense as well.
And is that one of DFID's priorities as well, climate change?
Yes, it is. Yes, so we have a large climate programme that's operating. We're working very closely with the Ministry of Climate Change on that as well.
Okay, great. Great. We have run out of time, but I want to thank the panel. This was a very interesting discussion and a very timely discussion as well. I'm really glad to see this document, and I really hope, fingers crossed, that it's going to be implemented and make a real change for Punjab. Thank you so much for joining us today. Thank you.
Thank you very much.
Thank you. Bye.
Thanks very much. Thank you.